Well, welcome to the Quantum Healer. I'm your host, Reverend Dr. Tracey Allshafer, and I am here today to talk to Priyanka Shah. She's an occupational therapist assistant, and we're going to be talking about Graston therapy today.
Correct.
So, first of all, tell us a little bit about yourself. How did you get involved in occupational therapy? What is it that you do?
I started off working in nursing homes and giving out different exercises, and then eventually I moved over to working with a chiropractor where I learned about Graston therapy and different techniques to help really alleviate muscle soreness and stiffness, which I started leaning towards. I loved what I was doing there, and from using everything I learned there, I started my own business, Nucleus Wellness Center, that kind of put together what I believe to be the proper form of therapy for someone.
Well, in the show, my whole purpose is to spotlight different techniques that help accelerate healing. And I have not heard of Graston therapy before. That was a new thing to me. So I always enjoy understanding, okay, maybe it comes from an old modality or an ancient technique and it was modified in some way. Can you explain it better for our audience? What is Graston?
Yes, so that was created in about 50, 60 years ago from an athlete named David Graston. He happened to have a knee injury and he went through different physical therapy and talked to different physicians to help his knee out. And when none of those modalities that he saw was working, he decided to create his own called Graston Technique therapy. So he created these fine instruments of stainless steel that helps with different muscle groups, with finer areas, with larger areas, and each instrument is specifically designed to help out a different part of your body.
Okay. And there are how many? 1, 2, 3, 4, 5, 6 instruments?
6 instruments, okay. Yep. And I'm going to pick up the largest one we have.
Sure, yeah, let's show everybody.
Yes. So this is the GT1, a little overwhelming when you look at it.
Pretty big, yeah.
Yes. And this is used for generalized big muscle groups. I like using this personally on my bigger clients who their back, their shoulders, a little bit of just generally relaxing that area before I get into finer parts using my GT3.
Okay.
So this is more, we'll go into like your specific muscle area around certain joints, really focus in certain areas. I love using the GT6. As you can see, has different curvatures and different sharp edges. That is mainly designed for the hand. I use this a lot with people who have arthritis, carpal tunnel syndrome, and it really gets into the bony prominences of your hands, around your joints.
I'm a massage therapist. I've been working a lot with people lately with wrist issues and things like that. And you find techniques or ways to work with your fingers. And I know they do make tools for massage therapists to use, but I feel like sometimes I just can't. I want to make contact with whatever's going on and kind of feel it for myself. And it's almost like I'm having like a dialogue with it between my hand and this. Do you feel like you're able to make that kind of a connection with the tools and people?
Absolutely. So these tools help find disruptions in your muscles, like really help scan out the areas. So this is actually the first one I would use on you because as I'm going over this, it helps scan out and bring out this redness, this specific redness called petechia. And when that petechia is shown, that means that's the muscle area that needs a lot of blood circulation.
Right.
So that's kind of like maps it out for me. Like, okay, this is where your tightness lies. And that's when I dive in with my other instruments to get a little bit further. But through the instruments, you can feel the vibrations, the scar tissues, and kind of and even the client will be able to tell, like, oh, wow, that seemed a little, like, that area is a little rocky, right?
Oh, that's interesting.
Yes.
So as you're gliding over, you actually feel almost like a frequency or a vibration because it's coming through the metal.
Absolutely.
Oh, I love that.
It's kind of like kneading dough. You have dough and you're using your fine fingers to really see like which areas have lumps and stuff. These instruments just help you out without really putting a lot of aggressive pressure on your hands, which I think a lot of massage therapists go through. And actually, Canadian massage therapists are allowed to be certified in Graston therapy.
Oh.
So I tell people, like, it's probably really good to do an addition with any kind of therapy that you do to include Graston therapy because it's an easier way of detecting pressure and just puts that load off of you.
Yeah, it's interesting. When I was doing a little bit of research on it, I think chiropractors can do Graston. You mentioned working with a chiropractor, physical therapist or occupational therapist, and it said some massage therapists. What is the limitation there for massage therapists?
Right. So, from my understanding, the site itself, GrastonTechnique.com, says Canadian massage therapists, and I don't know why it specifies Canadian massage therapists versus all. Or if you are allowed to do some, a different type of massage therapist, maybe a deep tissue massage therapist or a medical massage therapist versus one who's kind of there to relax you.
I'll have to do a little bit more plugging in for those of you who may be a massage therapist and are thinking about, looking into this or adding this. Because, like, we talked a little bit about cupping before, and I had told you we did an episode on cupping.
Yes.
And Rose Ford, who is a phenomenal human being, she's a massage therapist in Hamilton. And she just does cupping with her massage. She integrates it in. So she might have a couple cups on, but she's still doing other
massaging.
And then she'll take the cup off and then she'll work, differently through that area. But so she integrates it into her massage. So you probably have to take a certification course. What did you have to take? How long?
So it's about a 16-hour course. There's one part that's about 10 hours, and that's the essential trainings. So that just teaches you about each instrument and like the general understanding of the instruments. So that's about a 10-hour course. You could do it hybrid or you could do it in person. I did it all in person. And then there's a 6-hour advanced class that kind of goes into the deeper, like, certain diagnosis that you have to work with and what you can do, whether it's TMJ, to carpal tunnel, to plantar fascia. So that was an altogether 16-hour course, totally doable. It costs a little less than $1,000. I tell everyone you can invest in it.
Yeah.
It will do you good.
That's not a bad investment. And then I'm sure the tools cost a little bit more than that.
Yeah, yes.
I did look into that. They're a little expensive.
Yes.
But they're stainless steel and, they're made for certain purpose. So
they're an investment. And so I know there are numerous instruments now out there that are designed in a similar fashion, which I actually have purchased in the past just to kind of see the difference. And their edges and the way they're tuned, I don't like them compared to Graston. So this is like, to me, the finest of the finest.
Gotcha. I did look into, when I was reading on the Graston website, when David Graston, he had kind of done some research on his own and developed a certain thing, but then I think I can't remember where they were from, but he got together with some doctors and they together collectively created this technique. So you do have this athlete that said, hey, I'm not healing fast enough, or this isn't, whatever he was doing at the time, it wasn't working. He wanted to do something else. I wonder what sparked in him this idea, but he's, do you know?
I am not exactly sure. I did try to read up on that. I wish I could have more information for you. I think that's another why that we're going to do.
It's an interesting, like,
how did he even come up with this? Yes.
But, often I tell people who are experiencing pain or limitation, let me just see what I can do. Just start working the tissue.
Exactly.
Just let's see what we can get some circulation in there or break up scar tissue, whatever we can do, and see if we can get increased mobility. Or I've been seeing a lot of people lately with nerve issues, which I think are related to a lot of musculoskeletal issues that are creating
Absolutely.
impingements, right, in the nerve, and then the next thing you know, their arm is numb or they're having issues with their hand or wrists.
And then
So
the most common issue, especially for those who are working desk jobs, whether they're standing at their desk or sitting, for some reason, their neck and their cervical area is constantly in some sort of pain or stiffness.
Yeah. Yeah.
And I do see that these instruments help alleviate a lot lot of that. It just pushes away like that muscle tension that's sitting on those nerves,
Right.
causing those impingements. And I love it for that.
Yeah, so we're talking about healing, and we're talking about quantum healing, which to me is anything in the quantum world. So anything in the manifest, unmanifest realm. But we are, this is a very physical aspect. So for me, at least, I believe once you have pain or chronic pain, whether it's from injury or trauma or whatever it should be from, it's been in your energy field for kind of a while before it landed there. But we can work on the physical issue, and then if you have really a skilled therapist or practitioner who also understands a little bit more, which I think is what you were getting at with occupational therapy.
Yes.
You can understand the person more in a totality. And then you're able to help them in a different way, in a more
Absolutely.
deeper way.
Sometimes you want to understand their emotional stress, not just their occupational stress. They can say, hey, it's really hurting while I'm at this, I'm putting things in, whatever they are doing for work, whether they are a chef, and then you ask them about their stress levels, what, and they'll go off about something else. Like, I also have a little bit of stress about my family or something financial. And that's when you're like, okay, well, stress usually lies in the neck area for a lot of people. So let's go from there and move down to your back and kind of have like a holistic all-around approach, rather than, okay, you have an elbow pain, let's just look at your elbow. No.
Yeah.
I want to look at that whole muscle group and see, where your emotional and your physical stress intertwines.
Yeah. And so if we can go into those other layers, that's where the real healing comes from. Sometimes even just verbally talking about it can release something for someone or open them up to a deeper healing.
Oh,
right?
absolutely. They're just like, well, it's pain. It's my age, There's no need to talk about it. I'm like, no, you need to absolutely talk about it. Like, everyone kind of puts their pain aside because they're like, everyone goes through this. What's the need to talk about it? No, talk about it. That itself will start doing some healing itself. And then, you could understand a little bit more about what's going on. It also helps me understand what's going on.
I always love the phrase, suffering is optional.
Yes.
I think that there's a lot of people that just go, it is what it is.
Right.
Like you said, it's my age, or, oh, I played football when I was younger and I have these issues, or blah, 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 blah. And then maybe they've had a surgery, or they just take a lot of medicine every day, but it's not creating healing, and it's keeping them in a loop of pain and suffering.
Yeah, they make it normal. They normalize their pain. Okay, it is what it is. No, pain is not normal. Let's really understand it. One of my clients underwent a motorcycle accident about 15 to 18 years ago, and he's now in his early 50s, and he's just like, it's a persistent pain that's been there. It's okay. I said, that's where you're wrong. And we worked consecutively for weeks. About 4 months, he came to me every week. And after about the 4th or 5th month, he was like, Priyanka, I am feeling like I am in my 20s again.
Wow.
I am 100% better. And I have never told anyone you'll feel 100% better, because a lot of the work has to be done onto you as well. But just hearing that made me feel so confident, and really helped me have more confidence in my company.
Yeah.
Like, okay, I am onto something, and this will work for people.
When you get to the point where you actually feel pain, what is your body telling you?
That's an interesting question. So you're talking about the actual aspect of feeling pain, like when it actually registers in your brain.
Yeah.
So I think that's when you have the time, because some people just move along when they're stressed out. I have worked with clients who help out their spouses, and they forget about their own pain because
Yeah.
their job is to help out their spouses, their children, who whatever it is, and they're like, oh, I don't have any pain, until they're able to sit like down and really look inwards and be like, okay, what's going on with me? You know, we have all our five senses that look outwards in the world: our eyes, our nose, our mouth, our ears. It's hard to let those senses look inwards sometimes. Okay, what's going on with me?
Exactly.
And that's what I tell people. Like, okay, like sometimes I'll palpate different muscle areas that, like, if you say your knee hurts, I'll start going around your hip flexors and your lower back, and it'll kind of like trigger, like, oh, that area is not that comfortable.
Yeah.
And I'm like, okay, so let's look into why that area is not there, and what do you do about it, and like what's really bringing out that pain. So that's important, just being able to calmly sit down and say, hey, what's going on with me?
Yeah. So you have people that have pain, but they're not even registering it because they don't have time for it. Mm-hmm. Right? There's a lot of people that just dismiss, like, can't even think about it because I got to get stuff done and that's my life.
Yes.
So you have people that just don't register the pain. Mm-hmm. And then you have people that make some kind of space or time and go, oh, didn't even know that hurt. Mm-hmm. Now I'm feeling that pain.
Right. So talking with a client while they're on my table is my favorite thing to do because, you know, just making them laugh. I'm kind of silly. I'll start saying jokes. If they're like, oh my God, this hurts. And I'm like, just breathe with it. And I'll like sing to them. And they're like, you're treating me like a kid. And I'm like, adults need to be treated like kids. We all need to kind of have a little bit of play in our nature.
Absolutely. You know, while we're talking about pain, just, let's get back to these for a second because I'm sure some people are thinking that probably hurts. Does it hurt?
It is not the most comfortable form of therapy. My elevator pitch to describe this is it's like being a dentist for your muscles. So, you know, you're going to feel relief after it, some parts during it. Like a lot of people love it when I'm going down their forearm, but then, you know, you get in those nooks and crannies that are a little bit more tight. They're like, ooh, you know, they'll kind of just like take a deep breath, but it's nothing that I would say like is not tolerable.
Yeah.
By you know, everyone can tolerate this. There are certain people who are not, the right applicants to receive Graston therapy, like people with certain high blood pressures, certain skin disorders, you know, open wounds, recently had a tattoo, pregnancy. So pregnancy is funny because you could do it generally on the area, but the bottom of the feet has trigger points that induces labor. Yep. So you got to make sure whoever you're talking to, you know their medical history very well.
Exactly. Mm-hmm. Well, that's the segue into why I'm here. I'm going to introduce you all to this through receiving a treatment. So we can talk about what area maybe to work on for me based on what I've got going on. And maybe you won't hear my whole long story. Maybe I'll cut some of that out. But I have chronic tension in neck and shoulders. I've had many a massage therapist tell me I'm the worst neck they've ever worked on.
Oh my God.
So there's that.
Okay. I love challenges.
I did have a herniation at C5-6 in 2000. Flash forward to last year, I had a rotator cuff injury here. So in 2000, I had a frozen shoulder here. And then last year, I had another frozen shoulder here.
Oh, my Lord.
Because of the rotator, I had several partial tears. So at this point, I have relatively good range of motion. I don't know if you heard that clicking.
I did hear that click.
So my problem is I really locked it down for healing.
Okay.
And then I just started doing a lot of holistic stuff. So at this point now I'm doing a lot of massage, and I feel like all this natural movement and use is bringing all the muscles back.
Yes, it's using your own body to heal itself.
Exactly. So now I think what's there potentially is around these partial tear areas, probably some scar tissue, or I don't know what's going on in there. Also, maybe there's like a 5% range of motion from the whole frozen thing that's still there.
Right,
That's
right.
potential. So my whole thought or was that from the occiput through the neck on both sides, and then this shoulder, maybe that would be what you want to look at.
Top-down approach, exactly. So let's get a little bit into it if you're ready.
All right, so we're going to check out some Graston, and then we'll come back and we'll check in some post stuff.
Yes.
Okay?
Yes. Awesome.
Here we go.
Okay.
Okay.
How did that feel?
Woo, that felt like a lot. I was surprised. I was saying to you, I left my shirt off so that you could kind of see the redness that you were talking about in the areas.
Yep, from your cervical area all the way down to your shoulder, and a lot of tension that I even felt in the elbow, which has a lot to do with that wrist inflammation that you were talking about.
Yeah, yeah. But this arm, I was shocked, hurt when you were working on it. Like, this one was uncomfortable. It was like, oh, yeah, it's uncomfortable. oh yeah, I feel the range of movement restriction, like nothing surprising. But then you got here and I was like, oh, that really hurts.
Because your left side has been receiving so much healing and treatment that your right side, we forget that that's the compensating arm. That's the one that's been taking all that load off the left shoulder. So that's easily forgotten about. And when we finally start working on that palpation of muscles we were talking about, that's when you're really like, oh my God, I have a lot of stiffness here that I didn't realize because this side was hogging all the attention.
Mm-hmm. Yeah, totally. Boom. Was
Yes.
like very, very aware of that.
Mm-hmm. So Tracey was actually a little bit even more red and more tight in that cervical area than the left side. Exactly. As I was going over your scapular area, your rotator cuff. It was surprising to you, which I found delightful because it was kind of it was like showing an indication to you, like, okay, that this is where a lot of your stiffness is lying. It's not just your left side. And what did you feel when I was going over the areas with my instruments?
Yeah, I felt like what did you say, rocky road? It does. It's kind of like that. It feels like you're kind of like grinding over something, and you could almost feel, like you said, the vibration through the metal, like the like it wasn't just. It was
not smooth.
Like, right?
No, it was like going over like bumpy gravel.
Yeah.
Yes.
That bumpiness. And this felt like, I think I had saying to you, it's like, it's irritating. It's just like irritating, like almost nails on a chalkboard, just like, ugh, just stop. I don't like it. And then when you got to some of the points on here, I was like, oh, that really hurts. I feel that hurts because that muscle's just so tight. The neck, there was a couple spots like that. As you got closer to here in the top, I was like, oh, I can feel how red that is right there.
Yes.
I can feel the heat.
Yeah, exactly.
On that side. Because this, and I was almost going to go, stop. Like, I don't know if I can even do it. But then you were like, we're done.
It's not supposed to be 30 to 60 seconds longer in a certain area. So thankfully, there's not a lot of torture, not a lot of room for torture.
Yeah.
But the stretching is so important afterwards because that really alleviates kind of like all that tension you're holding in. It kind of like relaxes it, the therapeutic stretching. That's why I really like the cupping gliding.
Yeah.
The gliding cupping rather after the Graston therapy because that boosts that tissue mobility, gives that increase of blood circulation. So everything combined is like an all-around approach.
Yeah.
And it's not just a one-session thing. I tell everyone, you might feel good for a couple of days after this, but if you're in a routine where you're coming to me, every week, at least for a couple months, you'll see a significant improvement with your range of motion, your stiffness, your pain.
I can definitely see where this would be a good therapy to come back to again. If somebody wants to look for a Graston therapist in their area, they can just go to the Graston website. And is that a good resource for finding?
You can just search up get Graston therapy near me. A lot of people have found me through that, just typing it into Google.
Okay. Thank you so much for
thank you, Tracey,
coming on the show today and talking to us about this therapy.
Absolutely. It was so nice meeting you.
Nice to meet you too. Thank you.
Yes.